today. So yeah, welcome to our virtual course, Mental Health for Adults with Developmental Disabilities During COVID, a virtual course for family caregivers. We are really delighted to have you here with us. It's lovely to see your faces. Some of your faces I saw in the orientation, but it's really great to see some new faces too. This is our second cycle of the course. So we offered this course in the fall and learned a lot of really great things about that. And we're really, really excited to be offering it again. So thank you for taking the time out of your very, very busy lives to join us in this virtual space, to come together and to learn together. And so we're going to start our session today with a land acknowledgement. So we're going to be doing a land acknowledgement before each of our sessions. So I thought it would be helpful to just reflect a bit about what these acknowledgements represent and really why we do them. So land acknowledgements are really sort of an honest and historically accurate way to recognize the traditional First Nation, Métis, and or Inuit territories of a place. And they can be presented in all kinds of different ways, verbally, like we'll be doing today, but also visually. So you can think about signage, short theater presentations, or spoken word greetings like we're doing today. So we really use these acknowledgements to commemorate Indigenous peoples' principal kinship to the land, and use it as a way, as sort of a starting place to a change in how the land is seen and talked about. I think land acknowledgements also really help Canadians recognize and respect Indigenous peoples' inherent beliefs when it comes to the land, especially since those beliefs were really restricted for a very long time. So part of the point in making land acknowledgements is to recognize how systemic and institutional systems of power have oppressed Indigenous people, and how that oppression has sort of historically influenced the way non-Indigenous people perceive and interact with Indigenous people. All of these things are still, quite relevant in today's cultural and political climate. So here in Toronto, as you'll see on the slide, at CAMH, we're situated on lands that have been occupied by First Nations for millennia. So lands rich in civilizations. And at our hospital, we're really committed to reconciliation and to honoring the land through programs and places that reflect and respect its heritage. So we embrace the healing traditions of our ancestors and try to weave them into our caring practices. So the site of CAMH appears in colonial records as the council grounds of the Mississaugas of the New Credit. But Toronto itself is home to a really vast diversity of First Nations, Inuit, and Métis people who enrich our city. So we recognize that we have people joining from all across Canada, and you may be sitting on different traditional lands where you live or where you work. So if you have a land acknowledgement you would like to share, please send that to us. Or if you would like to lead the land acknowledgement at the start of one of our sessions, please let us know. We're really, really happy to have you do that. So thank you for taking the time. And yeah, we look forward to doing that each week. So I would also like to ask at this time if my course co-leads, Lee and Yona and Nicole, who is joining us today, if they could quickly introduce themselves.
Sure, I'll go first. My name is Lee Steele. I'm a very proud parent of 2 adult children, and I'm here mostly on behalf of my eldest son, Eric, who's 29 years old. And I have the privilege of working with Dr. Yona Lunsky and her team at the Israeli Center at CAMH. And this is just really, it's thrilling to see so many of you all across Canada. I'm so excited.
Thanks, Lee. Yona, do you want to introduce yourself?
Sure. Hi, everyone. So I direct the Israeli Adult Neurodevelopmental Center here at CAMH, and I do a lot of research focused on families and developmental disabilities. And also importantly, I think, which is why this is my favorite activity for the next 6 weeks, is I have a dual role of also being the little sister to someone in Toronto who has a developmental disability, who I don't live with, and who is very much, I think, impacted by everything going on with COVID. So nice to meet everyone.
Thanks, Yona. And Nicole.
Hi, everyone. occupational therapist, and I'm also a teacher in Kingston, Ontario. And I'm very proud to work with Yuna and this team, and also very proud to be an older bossy sister to a 36-year-old who lives in Barrie on her own. So anyways, I'm really excited to be here to this journey with you today.
Thanks, Nicole. And I realize I haven't really introduced myself. I sort of jumped right in. You can probably see my name's Joanna. I'm a clinician scientist and a psychologist in the Azrieli Center that Yona spoke about. And yeah, I'm thrilled to be here for the next 6 weeks with all of you talking about this very important topic, and really grateful for the support of this incredible team. So today our talk is going to cover mental health and your loved one during COVID. We'll talk a bit about a new model called the HELP model. It's about understanding and supporting your loved one. And then we'll share some resources and tools with you. So let's get started. I'll turn it over to you, Lee.
Thanks, Joanna. So just as this question asks, into the pandemic, 11 months now, what is the biggest challenge your loved one is experiencing right now? And, there might be others. And we're just going to do this as a Slido poll. Just take a moment and just get a sense of what your loved one's biggest challenge is. So we can see that loss of social connections is really huge. And Maria added in the chat function, mental health difficulties. And many of you others said that as well. So it's just a quick kind of snapshot of what we're kind of feeling about where our loved one's at and what the challenges are. And 11 months in, we're really feeling a lot of these things. So we're just going to quickly try something for the first time. This is one of the things we've learned from the first time we did this session, that you really like speaking with each other as well. So we're going to just spend what would you say, Joanna, maybe 5 minutes in a breakout group and just sharing with each other, given these challenges we just talked about, that you identified, what's one thing you found most helpful for your loved one? And that's whether they're living at home with you or whether they're living in a supported living situation. So yeah, I'm just, I know this seems almost like an obvious question, that have you noticed any new behaviors or changes in your loved one? And if we all saw each other, I'm sure all of our hands would be up that there's some new behaviors or changes that we've noticed. So if you could just take just a couple of moments and just type in the chat function, what changes have you noticed? Just in a couple of words. Thank you so much. I see, irritability and anxiety and increased angry sounding self-talk, low mood, loss of routine and social connection, asking lots of questions, not sleeping, boredom, money management, less energy, sleep again, more depression, anxiety, more isolation, missing that social contact, video games from the boredom, I'm sure, all day and all night, frustration, worsening obsessive compulsive behaviors, and so many events, more emotional, missing work. Phew, just even looking at that list kind of makes you just kind of catch your breath, doesn't it? So thank you for sharing. And I certainly am experiencing that too. So today our teaching is going to be about a model that we hope will find helpful. So just looking at that, in the example of what you wrote and identified with, what would you do next? Just reflecting on your own situation, providing consequences for a behavior that challenges, or you're worried enough to call your family doctor, or you're trying to find virtual supports. So as a poll here, just again, your Slido will just come up and you won't have to log in all over again. And maybe some of these, none of these apply for some of you, and there's other things that you can add. And you know, it changes, doesn't it? It changes from day to day. One day you feel like, wow, this is really severe and I need to call should I be calling the family doctor? You know, where else do I go for support? Yeah, and I like what you wrote, that a consequence, maybe that's a really good sensitive word we're all, I think, very attuned to, that it maybe implies a behavior that's wrong. And thank you for pointing that out in the chat function. I'm wondering what a better word would have been than consequence. I guess just what would you do next? Because yeah, thank you for sensitizing to that word consequence. So different people are trying different things. Lots trying to find some virtual support, family support, and thank you. So it's just a really, really challenging time. And as Nancy said, depending upon what the response is, and it's really really keeping us on our toes as caregivers. Thank you everyone for sharing. Nicole, I wonder if you might speak to this slide.
Yeah, thanks, Lee. And thank you everyone for sharing your experiences. It seems like with this, there's a lot of common experiences. And one of the things we're hoping to give you today is another tool in your toolbox to help with the assessment that you do of yourself and your loved one every day. And what we wanted to start off with is just checking in about the difference in terms between mental health and mental illness. So in some of the things that you mentioned earlier about increased anxiety and aggression and low mood, when is that part of just the experience of being human and experiencing our mental health, or our state of mind and thoughts and feelings? When does it become more serious and become something that we would refer to as mental illness? So when these thoughts or feelings and actions starts to become long-term and stops you from doing the things you want or need to do. And I think that there's a distinction when we all experience mental health. And I think currently, the situation that we're all in, we're all at risk of more mental illness. And so having these conversations, I think, are really important. And some of our loved ones, I think, may be more vulnerable to that mental illness because of the things that you mentioned, the loss of social connections and meaningful activities. So just wanting to start off today and this session with an introduction to mental health and mental illness as terms. And then the next slide, Lee and I are going to share with you something called the HELP model. And the HELP model, as it says here, helps us to think about the things that are important to our mental health and to try to identify when there might be a problem. So we will go through the H, which stands for health, the E, which stands for environment, the L, which stands for lived experience, and the P, which stands for more psychiatric conditions, one at a time. And what I wanted to share with you about this slide is that we have versions that have been developed by self-advocates for self-advocates, by caregivers for caregivers, and similarly for service providers. So these will be in your resources, but just wanting to show you that they're out there, and it's the same message. It's just tailored to make it kind of easy to understand and the most helpful it can be. So Lee, did you want to?
Thanks, Nicole. I just thought if we could start with a bit of a story. This is like a composite of stories that I've heard from other caregivers and my own experience, and maybe just and because you've already done so much great sharing already in the chat function with each other, my loved one in this story is Aaron. He's 32 years old, and he, as all of our loved ones, experienced many changes and losses during COVID. Aaron lives at home with me. I'm a single mom, and as we all know, those supports and the meaningful activities ended really abruptly. And so the ability to cope has become more difficult as time's gone on. Aaron stays up later and later, between 12, 1, 1:30 at night, is getting up earlier, waking up at 10, 10:30, 11. And so is drinking coffee and colas, 3 to 4 colas throughout the day. That seems to feel like it's boosting mood, because there's a lot of boredom, feeling tired, and some irritability. So what I've noticed sometimes is that things that would maybe not be so worrisome at one point are really now causing a big disruption. So say the computer doesn't move, load quickly enough, or you can't get on quickly enough. That is, it causes a lot of anxiety, and it seems like almost out of proportion the reaction, which then startles me. And the fact that I don't have very much reserves in my tank means that I end up responding not the way that I would like to, with a lot of patience, and then I feel guilty later for not being patient enough. And it's a little bit of a cycle. So Aaron loved to go to the gym, just loves getting out and about, going to the gym, loves exercising. And so now really with the gyms closed, the exercise is going for walks. And so watching lots of movies and TV, or being on the computer. And as we mentioned in our small breakout group, it's getting harder to motivate. And so as a caregiver, I'm at a bit of a loss. I feel lots of times like I'm nagging, and the other people that Aaron would have interacted with previously just seem to have kind of evaporated. And so I feel that really big importance that we get along. And because Aaron is so social, and he loved going to the gym and out in the neighborhood, those virtual classes that are offered as sort of the only alternative right now don't seem to really fit for Aaron. And for, maybe they worked at the beginning for some of our loved ones, but, in other ways, they're not working so well right now. And we live in a really small apartment. So I'm trying to work from home, and we're on top of each other. And it's just, I'm like not having really, I just feel like I'm not really very effective at work, and I'm either sort of robbing Aaron to look after, to be supportive there, or I feel like I'm not doing a good job at work, and I feel sort of powerless at times how to help. I'm missing my daughter incredibly, and I'm missing my mother, and my sister. My mother's 93 years old. She lives in BC, and my sister's very sick, and she lives in BC, and how much can I support sort of over the phone? So for me, I'm not sleeping well either. And I find that when I do finally have some time, I'm sitting on the couch and watching sort of mindless TV and eating emotionally, because I'm feeling either scared, sad, lonely, or all of the above. I have to push myself to go out for walks, even though I know it's good for me. And I seem to be way more forgetful, even to drink water, which I know would help. I'm eating when I'm not hungry, and like I said, I think I'm just swallowing sadness there. Even like small things on TV, like commercials, can move me to tears if they have some sort of sad aspect to them. And that sadness is also not being able to connect with others is really affecting Aaron. And if he reaches out and people don't get back to him so quickly, then that really causes memories of other times when he's felt lonely or rejected, or people not getting back to him. So it's not just this moment of loneliness he's feeling. There's previous history of that. And even myself, I'm not finding that I reach out for help in the same way or for that support. Like, I feel like I don't have a lot to say. And I know that everybody's going through it, that it's sort of like Groundhog Day every day, that I'm just sort of, I know that I need to take care of myself and put that oxygen mask on myself, so that I'm there for Aaron, but I'm also finding that, wow, what would I really say if I reach out? So I'm kind of, I hesitate sometimes. So anyway, that's kind of a composite story. And I know that each of us has our unique stressors and our unique situations. For those of you who have a loved one living in a group home, I can't even imagine, the grief, the frustration, and the sadness that you've also had to bear as you're trying to advocate like you always did, but couldn't during this time. So I hope you can resonate with that story. And that's sort of, we want to use that story as a little bit of a framework to explain this model now, that help model that Nicole introduced us to a moment ago. So I'll go back to you, Nicole, if you can help us work through that model, and then we'll pull on this example that I gave to make it sort of come to life for you as well.
Thank you, Lee, for sharing, and I think we can all resonate, and it sounds very much like the community also, it resonates with many of us who've joined the call today. These are complicated times, and certainly there are lots of complex situations, and I wouldn't say this is a be-all and end-all approach, but it is a way of thinking about new behaviors that you are seeing in your loved one, and also a check for us as caregivers. So before we would say something, potentially, while you're waiting to see mental health specialists, one of the first things we like to check is people's physical health. So sometimes we mistake health issues for behavioral or mental health problems. It could be pain or discomfort that might be expressed differently, and you are in the best position to know your loved one, but it is important that we systematically check. A lot less exercise, a lot of screen time before bed, and Lee can certainly, I will leave it to her to pull this story forward, but those are sorts of things. And I think the next slide shows us ways in which we can teach people, or things to check for, are we actually doing, and how well are we doing with this. But it also is for us for monitoring. There's monitoring forms that can help us collect important information about how people's health is doing. And Lee, if you wanted to share and pick up a little bit about health from your perspective.
Yeah, thanks, Nicole. Like, just so pulling from my example earlier, that staying up late, that sleeping in more, not getting enough exercise, being less active, then there's, maybe that sluggishness or that uncomfortable feeling, or could be pain, and it could be something like constipation or body aches from sitting in that position, a position for too long. So I really, think about, when I think about health, I just think of as, and there's a lot on this slide, and don't worry, we're going to share all of this with you, but just thinking almost of, is there enough drinking? Could that lead to a urinary tract infection? If it's a girl, we hold the history of our loved ones who are ladies, that, what's it like before, during, after their period, and even though it's challenging to see our family doctors in person, virtual visits are very much encouraged. And then between you and your loved one and the doctor, that a decision can be made whether you need to be seen in person. One thing I didn't realize really just until I joined the Israeli team was just that 1 in 2 adults with intellectual disabilities are on 2 or more medications, and 1 in 5 receive 5 or more medications at the same time. So all those side effects, can really be something to think about. So having the medication reviewed regularly, and monitoring that, you know, for antipsychotics that some of our loved ones are on, you know, having their weight gain checked, or other metabolic difficulties that can arise from being on these medications, the dizziness, the sleepiness, stomach upset, nausea, all of these things. As caregivers, we can be on the lookout. And I like this, that how, you know, behaviors that challenge are often, you know, not picked up as health issues first. That's why we always start with the H in help, to really help us look for health issues first. And I in preparing for today, I read in one of the resources we'll share with you, is just start at the head and work down. Is it the hearing? Is it vision? Is it a toothache? You know, and then work down to the feet. You know, is it an ingrowing toenail? And then, you know, and with your doctor, I just really encouraging us to see our family doctors first.
Thanks, Lee. I think Lee.
I guess these are some of those charts, right, Nicole?
Yeah, I think, you know, you spoke pretty eloquently about this, but in the caregiver and also the provider resources that we'll send out, there are examples of forms and tracking sheets that can help. And if you did them in before seeing a doctor, they can really make those visits much more effective. To say, hey, you know, and you've probably had lots of experience with this over the years, but the more information that you can bring to those appointments, the better collaborative decision can be made. And I think, you know, recognizing from the chat that there are doctor shortages and waiting lists, and so, you know, it's not they're not easy answers, but we're hoping to give you the tools to be able to do what you need to do in the interim. After we've looked at health, we wanted to look at environment, and you've already mentioned so many changes. What an unprecedented time for environmental changes. So pandemic restrictions mean that there's a huge loss of social connections, loss of routines, and some people have adapted well, and others are struggling and continue to struggle with this. What I really like about the help model is it gives me tools and questions to think about the changes in our environment, and how do we address that. So, you know, did somebody new move in? Did, you know, what's going on new in the house that maybe has changed? Even if it's a rearranging of furniture, because of restrictions, are people staying in the same room more than other rooms in the house? So gives you some questions to think about changes in environment, as also to talk with your loved one or the staff that support them about really understanding what makes people feel good or bad, to really build that environment that makes them feel the best. So I can't overstate the importance of environment in our connection to our mental health. So Lee, I would send it over to you if you wanted to add.
No, I think you've explained that really well, Nicole. And as an occupational therapist, you must really be on the lookout of environment, you know, and just, you know, it's just a great opportunity for us afterwards, that we can maybe make small changes in our environment, or reconsider some of these things, because the pandemic's dragged on so long. Maybe there's changes that worked at the beginning that we have to kind of re-reflect. And you know, I was thinking about this, you know, even for me, I have to reduce my expectations about myself, my own environment, like trying to work from home and support my loved one. I can't do it all. You know, so I'm also reducing my expectations around my environment. So I think that, yeah, it's just really something that I might have overlooked, to really look at this again, at the E after the H, the E, looking at the environment. Thanks, Nicole. I'll just let you keep going.
For sure, light and time.
Considerate of time.
So the next one, and we spoke about, was lived experience. So we all have positive and challenging events, and we're certainly living through one. So looking at how loss and grief and anxiety, just how we support that in the people that we love. I think that that's a key piece when we look at, and I think the next slide can certainly help in terms of offering the resources. Help suggest, sharing your story. How do we communicate and give space and acknowledge people's feelings, and even just give them permission to talk about it? And so asking people. So, and we have one more slide that shows the really great resources to help just read and be with your loved one, to help give them the time and the space to acknowledge their feelings. Lee, did you want to?
Yeah, they're wonderful resources, and a great plug for you to do your research so that you could get a copy of one of these. It's but I just was noticing, like, in terms of lived experience, just how quick challenging behaviors that challenge, can be really a response to this difficult time, but also a response to a previous experience that our loved one is still struggling with. I know in my loved one's case, it's as if some of these hurts just happened yesterday, even though they were years ago. So something that reminds, something that's happening right now reminds my loved one, and then it's like dominoes hitting. That reminds him of that particular situation, which reminds him of that particular situation. And it's all of that loss. And how much harder is it if they don't have a way of communicating that with us, and that triggering of a past event. And then we're going through death and loss of seeing those people that really give our lives meaning, or maybe there's been bullying or teasing or changes in staff, or all this routine and change, loss of routines and loss of activities, all these additional stressors. And as caregivers, we hold that history so we can advocate and give context to those behaviors that challenge, because we understand that bigger frame. We can connect what's happened previously and how it may be affecting them today. And for me, as a caregiver, I just have to remember that it brings up my old memories as well. All my years of advocacy, all my years of trying to help my loved one, the times I was successful at getting help and the times I've been unsuccessful, and it's a really unusual time. So to bring that compassion to ourselves too.
Thanks, Lee, for sharing. I think the last part of our model is that, once you've checked the health of someone, you've checked what's going on in the environment, you've offered some support from a lived experience, lots of the people that we love and even ourselves could benefit from seeing mental health specialists. And people might, like Lee said, might have a psychiatric problem such as depression or anxiety that need to be supported by mental health professionals. So in the next slide, the last slide, we have about the help model is, and I would say this for caregivers to talk to someone if you don't feel good, try to reach out, acknowledging those feelings are okay, and that other people could be there to help us. So just wanting to just briefly touch on that last piece, that a mental health review, looking at medications, getting the right supports, is an important part of this journey. I think I'll wanted to leave some time for Lee and Yona, so I'll let that go there.
Yeah, I just guess my sort of kind of thought about the P, Nicole, would be that, we know that behaviors are a form of communication. And we know that if our loved one's been sedated or medicated with any type of, medication, that their symptoms might be masked, and we may not know why they're acting a certain way. So that's why we really are encouraging that, looking at the H, the E, and the L first, right? And we know that it takes time to see a specialist, if we can even see a specialist, because so it's really important for us, again, as caregivers, to either chart these concerns ourselves, or ask group home staff to chart them. And again, in the links, we're going to be sharing the Family Matters Toolkit, which shows these different charts so that you can keep track of concerns, so that when you do see someone, either the family doctor or another doctor, you can say, I've kept track of this. So you're not just going to that specialist and then they go, can you please keep track of that? You actually can go to the appointment going, I've been keeping track of this with my loved one here, or the group home staff has been keeping track of this. So here, and then, you can do that between now and if you feel that it's important to see a mental health specialist. And again, I even feel guilty saying this because you're all so darn good at it, but we can't stop the stress. We know that, but we know those coping strategies that are unique to our loved one. And I saw lots of them sort of coming up in the chat function, like weighted blankets or something soothing that we know works. They're unique to our loved ones. And next week, we're going to discuss tools that will empower our loved ones' preferences to be put in a written form so that they're clearly understood. And just again, as a kind of a final plug for us, when we're thinking about the help model, just asking ourselves, how am I coping? And do I need to reach out for supports? And even though I said earlier, I feel kind of boring, is there just one friend I can call to talk to, or do I need additional supports? So help is, and I encourage us to ask for help too. So yeah, I guess based on this, wow, look at how fast you guys are getting at the Slido function now.
I'm just going to make a few comments while people are responding. It looks like most people have given a response here. I've been sort of just observing the chat box, and lots of topics people were asking about in the comments. Session 1 is really like a framework or an introduction to mental health, and the help model, I think, is getting us thinking about communication, getting us thinking about mental health treatments and medications, getting us thinking about grief and loss. And all of those things you'll see in the outline of the 6 sessions will come up in more depth in the weeks to come. I think there were just 1 or 2 last slides. Lee gave us a really important reminder to us that the help model, which we apply to our loved ones, should also apply to ourselves, or what's the point of it? So that was my second slide. And then this slide here, I just want to comment, and again, with a 30-second story. Sometimes what other people see without the context of us knowing our loved ones best might seem like it's a certain way. So for example, if my sister has suddenly decided that it's really just completely fine for her to not be hugging or not that enthusiastic about seeing people and not yelling in a very loud voice, some people might say, well, that's awesome. Like, what did you do? She's doing great. Well, I know that her normal is using a very yelling voice and being very huggy and affectionate and very energized. So if I see that those things aren't happening, I have to think about what her sort of baseline or usual way of being is. So one sort of link we'll share with you is the Know Your Normal toolkit. And another one is one that's sort of more Canadian based that we developed with folks in Special Olympics that talks about understanding my strong mind. And it's really sort of a way of helping people with developmental disabilities and us to think about what is the usual so that we notice something is different. So when we're sort of applying this help model, we need to think not just about what other people think is good or a problem, but what really is a unique problem for the person that we know the best. The other people may not know the best. And that's why I think our special knowledge of what they're like typically and how things have changed is so important for us to communicate. Yeah. So I guess this is our last sort of question we're posing to people to think about. At this point with the time, you can pop something into the chat box or just think about it for yourself. Is there one thing, if you applied help to yourself, that you could maybe focus on this week? And once you put it in the chat box, we're going to hold you to it. We're going to check in and see how you did. Maybe you can try that even once, even something very tiny, like trying to get a little bit more sleep or remembering to drink a glass of water in the middle of the day. Look at these great ideas coming up here. Thank you for putting those in. Because again, we all need help. This applies to all of us. So thanks for putting in your suggestions. I'm going to turn things back to Lee and Joanna.
Thanks so much, Yona. So this is just a quick review of what we covered today. Hopefully we were able to meet the things we set out to talk about. We're so thankful that you joined us in this first session, that you bared with us with technology and learning new things about Slido and breakout rooms and the chat function. We really appreciate all of that, all of the wonderful ideas and suggestions you've come up with too, and that you've been so engaged. It makes a really big difference for the course. And we hope you found today interesting and engaging, and that you learned something. And we'll be talking about healthcare communication next week. So we're very much looking forward to seeing everybody again.